Good morning, everybody, and also a warm welcome to this press conference from my side. I'm pleased to announce the official launch of the first European Year Against Pain. Why do we launch now a European Year Against Pain? First of all, because chronic pain is, I think, one of the most important and at the same time one of the most neglected and not enough recognized health problems in our societies. So it's now on us to give a wake-up call to the public, to give a wake-up call also to the politicians that there is a challenge in our societies, a challenge to our social service system, a challenge to our healthcare systems, and this challenge is chronic pain. You can see now also that it's not only an individual problem, it is a problem of our society because it costs a lot of money. It's not only the direct costs for the treatment. Of course, the treatment of chronic pain patients is expensive, and we know from these surveys that patients with a chronic pain have seen their doctor during the last 6 months between 2 and 6 times. But it's not only these direct costs for treatment, it's much more the indirect costs. And also here we can provide you hard data. We know that about 500 million of sick leave days are lost every year within the member states of the European Community, and that equals an amount of almost 34 billion euro every year. So that is money that could be saved and spent into the system and not just spent for sick leave days. Because of these direct and indirect costs, we can also recommend how to save part of this money, how to save the expenses for the budget, for example, for social services, how to save money in the budget for healthcare, and that is to prevent the development of chronic pain, first of all, and if it has developed, to properly treat it. And that is again not always the case. We know from the survey, and you will find the resource of these figures in your material again, we know from that survey that only 2% of the patients with chronic pain are treated by a physician who is actually trained in special pain management. And 1/3 of the chronic pain patients is not treated at all in a specific manner for this chronic pain. So there is a lot of deficits even in our well-developed countries with their high-level healthcare systems. One of the major problems we always have when we try to communicate this to the public, to the media, and also to the politicians is that many people, even healthcare professionals, misunderstand chronic pain as merely a symptom of an underlying disease. From this year on, we have a whole year, every year from October this year to October next year, and then in the following year. And it is always a special topic, a chronic pain topic that is in the limelight of such a European Year Against Pain. EFIC will provide material, web-based information, brochures, so-called fact sheets that are in the internet, that are available. You will find it also in your press binder. So giving first-hand scientific up-to-date information on the specific topic that is in the limelight during this year. And this year, for the first European Year Against Pain, it is the topic visceral pain. Visceral pain is a pain coming from the inner organs, from the bladder, from the gut, bowel, from the lungs, from the heart. And it is, when it is an acute visceral pain, known by all of us, because everyone here had already some type of an acute visceral pain, abdominal pain, pain in the pelvic area or elsewhere.
Thank you very much indeed for coming. My name's Chris Wells and I'm from Liverpool and I'm President-elect of EFIC, and I've also had the honour of chairing the committee of the International Year Against Pain for EFIC, and this is a new project, as you've heard. We have designed a new logo for this. Here's our logo. We're very proud of our logo. And every year, as you hear, we will have a different topic. So this year, we've selected raising awareness about visceral pain, the quiet epidemic. Now, there's two sorts of pain. We can talk about acute and chronic pain. And acute visceral pain is very important because it's extremely unpleasant and it's often life-threatening. So if you think of a heart attack, that is acute visceral pain. If you think of a blockage in your gut, that will give you acute visceral pain, appendicitis. So if we get visceral pain, we go and see the doctor. And most people have had visceral pain of some sort, even though they haven't thought of it as visceral. So period pain in women, which is extremely common, is a type of visceral pain. Indigestion from an upset of the bowel is visceral pain. Now, usually, either it can be treated or it settles by itself, but a significant number of people go on to get chronic pain, and those are the people we're really especially interested in. So we're now starting our year against visceral pain, and our priority is to help those who may have been silently suffering with pain for a long time. One of the key tags that we started with when we started the week against pain was don't suffer in silence. This is for patients, because we know patients have pain and we know that they don't seek out help for their pain, or if they do, they're told by their family doctors there's nothing to do. So what we've done with this campaign is, as we develop, we will have more, but on our homepage at EFIC, www.efic.org, which is in your pack, we have fact sheets on different types of visceral pain. These are all included in your information pack, and these are for doctors and for patients. So doctors who want to find out more about visceral pain can, and patients who want to find out where they should go next have these packs, and these packs give advice about other resources and how they should approach their doctor. And we need to improve the understanding of all specialists on visceral pain: cardiologists, people who assess the lung, the gastroenterology, urology, gynecology and internal medicine. We also hope that this campaign will give a boost to research, and we need to find out more clearly the causes of the problem, why it becomes chronic, how it's affected by genetics, how it's affected by the environment, and we know that biomarkers and brain imaging can help in this type of research. So Jacqueline Riley has kindly come along today. She's not used to being in front of lots of people, and she's very bravely come along to describe how difficult life can be with pain as a constant companion.
I say that pain is my constant companion, which is true, but I also refer to it as my enemy or the enemy, and I've not got to let it win or overcome me, and I try various coping strategies so that doesn't occur, but sometimes it does fail. I've had this for a very long time. It started approximately 16 years ago, give or take, and I was around about 40 years old, and I was suffering from severe back and joint pain as well as chronic exhaustion, and I just didn't know what it was about. And finally, my illness was only correctly diagnosed about 6 years ago, fibromyalgia, which is a severe chronic disease from the rheumatic group of disorders. The illness can have a variety of attendant symptoms. In my case, my greatest difficulty is with irritable bowel, which I have had for more than 10 years. It wasn't the initial problem that it is now, but sometimes I do not get a full night's sleep because of the pain in my back from my fibromyalgia, or the abdominal pain, which sometimes I don't get much peace from. The pain targeted therapy can, in the meantime, give me at least intermittent relief. I get injections in the spine every 6 months against my back pain, and from Dr. Wells, and I have also different drugs to help with my fibromyalgia symptoms. A variety of remedies, sometimes severe, have been used against the irritable bowel. Sometimes I use Imodium or Buscopan, and sometimes also codeine. And at times the irritable bowel can be so bad that I've had to be admitted to hospital because I needed intravenous pain relief. The intensity and the length of these pain attacks can differ greatly. Sometimes I have a swollen abdomen, severe diarrhea, and also I have vomiting. I can't keep any food down, and then I need to have injections to help the severe nausea. And since I can't keep because I can't keep the food down, on days like that I feel so miserable that I have to stay in bed and don't have the strength to get out, walk around the house or do anything. All this is terrible, but at least I know that at last what is wrong with me and how to get some relief from the discomfort. Beforehand, I had a history as a patient typical of what many chronic patients go through, from the GP to the orthopaedist, who can find nothing wrong with the spine, and back again to the next specialist, who can find no evidence of inflammation of the bowel, and so on. Back and forth in the health system, often with unbearably long waiting times and without any results. Stopovers at the psychologist who suspect childhood trauma or non-existent marriage problems, or self-help groups, which also get me no further. It was by coincidence that I finally encountered a rheumatologist who understood my symptoms better. He realised that my back and joint problems and the severe abdominal pain had a common cause. Despite the therapies I now receive, I am still far from able to live a normal life. I was sent into retirement 10 years ago on health grounds because I couldn't simply carry on. I had worked as a nurse in the prison system, which was a very responsible and stressful job, which became more and more of an ordeal for me. As well as having to drive to work, I had to supervise and administer drugs. And although I was barely able to function because of the exhaustion and pain and the use of painkillers, by no means everyone understands what I was going through. Many doctors included suspected me in the course of my illness of faking problems or of exaggerating them wildly, or that I simply didn't want to work any longer, and this was most hurtful. If I could have a wish besides being free of pain, then it would be for a greater understanding for pain sufferers. With fibromyalgia, there is no outward sign of illness, like contorted fingers or skin rash. I take great care with my appearance, cover up my pallor and exhaustion with makeup, and really pull myself together when I go out. Among my friends and acquaintances, I try not to always talk about the chronic pain. No one knows what an effort it is for me to take part every once in a while in normal life, and how long it takes for me to build up my strength again afterwards, or how hard it is to sit around with healthy people in an easygoing and cheerful way, reacting in a lively fashion as they do. But if I do not masquerade in this way, I put on a clown's mask every now and again to fool myself and the others, I sink into depression and loneliness. And that I don't want to do any more than give up on myself.